Welcome back to the Morning Brew here on CNC3. My name is Soini Gray, sitting in for Jessie May Vento. We are being joined by Professor Seemungal. He is the Dean of Medicine at the UWI St. Augustine campus. He also has extensive professional training in chest and general internal medicine, and he's done extensive research on chronic lung disease. And as you know, the COVID-19 virus likes to attack the lungs, so we are very happy to have Professor Seemungal on the show to help dispel some of the misconceptions surrounding the virus. Professor Seemungal, thank you so much. How are you doing today?
Morning. Good morning to the viewing audience. And it's a lovely morning, so I'm happy to be here with you all.
Thank you so much. The public is very interested in the presence of local variants, especially the Brazilian variant. How concerned should the average citizen be about these variants of concern?
Yeah, and yes, I think that we should all be very concerned. The variant of concern, which is the Brazilian virus, or the P1 variant, has been detected in Trinidad and Tobago in several places, and it spreads very rapidly. So all of these variants, there's the Kent variant from the UK, the South African, and one from India, they are more infectious than the original or Victoria strain, and spread rapidly and quickly take over the local, if I could use the term, ecosystem or viral ecosystem. So we need to be concerned because it spreads more rapidly and is more infectious, and therefore we have to be more vigilant with regard to our public health measures and how we respond to them.
And now I was asking because I'm hearing a lot of people talking about the Brazilian variant, and the Brazilian variant is responsible for the rapid rise in cases. But I was wondering if people were being too zeroing their concern on the Brazilian variant and not sufficient concern on what they should be doing to prevent the spread of the disease, watching your distance, washing your hands, and wearing masks.
Yes, absolutely correct. You're quite right. The way the virus spreads through the respiratory tract. So you inhale it. And of course, those who have it exhale it. And the only way to prevent that, short of vaccination, is to apply the public health measures exactly as you have said. And you know, while we say 6 feet, in view of the fact that this one is more infectious, perhaps a greater distance might be indicated.
And where are you on the position of double masking?
Right. Anything that increases the barrier between the virus and you is going to be better. So if you can double mask, yes, I think that it makes sense.
Now, we are at 5,762 active cases locally. Every day we have new cases in the hundreds. What is the real reason for such a significant increase in cases, in your professional opinion?
So I think there are two contributors. The first is, as has happened before, once people become a little too fatigued, for lack of a better word, with the isolation procedures, they relax a bit, and then you get a spike. And if you look throughout the world, this is not unusual. You're seeing it in other countries. Australia, which has had the best control since July last year, they had their own spike to deal with in July. But they've been able to control the virus far better than maybe a lot of other countries, even though they've only just started, well, in February they started their vaccination campaign. But the other issue is that in addition perhaps to a bit of fatigue that might have been occurring amongst our population, there is a new virus that has greater infectivity.
And
so it's a combination.
Sorry.
So I think it's a combination of those two.
Now, we're also noticing We're getting daily reports of death because of these increased positivity, and we're getting more reports of middle-aged persons with no comorbidities dying. I wanted to go back to my question on the Brazilian variant. Is it that the Brazilian variant is targeting younger persons, and issues that we thought made you vulnerable before is not the case with that version of the virus?
So I think it's related to the fact that it's more infectious. So if it's more infectious, it's going to get into the lungs and bind to those receptors in the lungs more tightly than the older variant. I think that's it, and therefore it will attack the lungs of more people regardless of age. Because remember, the other one, or the older variant, or the one that started the whole thing, was also binding to the lung. But it didn't do so to the extent of this one. So because this one is more infectious, you would expect to see a greater spread of the disease.
And you do a lot of research on lung functionality. What have you noticed locally in terms of how COVID-19 is dealing with local patients and their lung capacity?
So most of the reasons that people would come into hospital is because they can't breathe, which means that the virus has infected their lungs. So it is a virus that attacks the lungs. We are in the process of doing some research on that right now. We have a clinic that's set up at ARIMA, run by the North Central Regional Health Authority, and it's a clinic that's really, in my view, set up with facing the challenges of this century. So it's a multi-purpose clinic that looks not just at the respiratory problems, but cardiovascular, neurologic. All of these are the complications that arise from COVID. And we have to have, we are collecting the data now to look at a description of what we are seeing there. But if one looks at what is reported in the literature, the complications of COVID, which is another reason. You see, some people believe that because they are less likely to get the illness and wind up in hospital, they don't need to take precautions. But the other issue is that even when you get a mild version of the illness and you are managed at home, you can still get what is called long COVID, which is a persistence of the symptoms of the illness. And then you may have complications because the symptoms persist that affect other organs.
And of course, one of the comments that I've heard is that we still don't have full awareness of what the long-term effects of this virus will be on the body.
That's true. The side effects are, or the effects on the body are described. One is the persistence of COVID-type symptoms for anything up to 3 months, sometimes longer. There's specific syndromes that affect certain organs of the body. For example, you may get fibrosis of the lungs, which is a premature hardening of the lungs. You may get heart attacks. There are neurologic complications. And then there are complications, or I guess we call it a post-viral fatigue syndrome can occur, which the patient just feels tired all the time. And you can't resume your daily activities. And that, again, can take from a month to several months to go away. And there are various other syndromes like that that can affect you. And the best way to prevent them, unfortunately, is not to get the virus.
I hear that, not to get the virus. Dr. Miriam Abdul-Richards, her language at the Health Ministry press conferences are getting more and more urgent because of the pressing issue of just a lack of facilities. What are your colleagues in the medical profession telling you? This is such a hard question, but is a crash imminent in our healthcare system? Sorry, Professor?
I'm hearing you. I'm just thinking how best to answer that, because one doesn't want to cause panic amongst the population.
Right.
I think that the Ministry of Health is doing the best that it can to cope with what is a very difficult situation. Unless we can control the spread of the virus, the demands on our public healthcare system are going to rise. And the whole idea of putting up field hospitals to deal with cases that don't require in-hospital care, but still require close observation and perhaps oxygen, is what is going to help us. But if you look around, you will see that there have been countries, including the UK and the United States, where they reached a stage that they couldn't cope in. So one hopes that we don't reach there. One hopes that we really rigidly adhere to the guidelines that have been put out for us now, and that we simply put, but difficult, stop mixing. That's how it, we have to take that. In China, I mean, it's well known, Chinese put the army out. And one chap, there was a news report of one chap who tried to escape Wuhan, and they threw a net at him and caught him. They used very rigid measures, but it worked. And one hopes that people would listen to the advice that is being given, look around the world and see what has worked, and then, implement it here. And I'm not saying to be as rigid as in China, but what I'm saying is we need to follow the guidelines very, very rigidly.
How are your students coping with the virus? What kind of discussions are you all having at the university? Let me just remind
as for the rest of us, with a lot of stress. It has been very stressful for our students. We have withdrawn our students from the wards right now, and we will have to negotiate with the ministry that is the safest way to get them back out, because a doctor, after all, doctors certainly are not going to refuse to meet this challenge. All throughout the world, the challenge has been met by the medical and nursing professions working closely together. And we must not forget our hospital paramedical staff who have to transport patients and who have to care for the wards and so on, even if they're not directly touching patients. So all of these challenges are there for the health service personnel. And our students, not just medical, but nursing, pharmacy students, dentists, all have to deal with this when they graduate.
Yes.
We have been as supportive as we can, but sometimes we also need support.
Yes, we've been speaking about that on the show. It's very clear that our health personnel require all the supports and support systems. I was just wondering if some of the conversations you all are having at the Faculty of Medical Sciences has to do with offering support to students who are wondering what they're getting themselves into.
Yes. There is a student support system within the campus that is that allows students to access it quite easily, and we also have our own staff. In an emergency, they can contact us.
Professor Seemungal, thank you so much for joining us. Really quickly, how are those UE trials going? I know we were invited by the WHO to take part in an international treatment trial. How has that been?
Well, we have submitted our proposals. Our ethics committee has approved it. The National Ethics Committee still has to make a ruling on it. It must meet ethical approval before we can launch any such study.
Thank you.
They're carefully going through it.
Thank you so much, Professor. All the best to you and your students and your colleagues in the medical profession. I really appreciate this conversation this morning. And I'm hoping that our audience has listened and more inspired to wear your mask, watch your distance, and wash your hands. Have a good day, Professor Seemungal.
Thank you. Bye.
Bye. And that was a conversation with the Dean of Medicine at the UWI Faculty of Medical Sciences. We're going to take a very quick break, and we're going to switch gears also slightly when we come back.